Well, over the last year, motor premiums for customers have fallen by about 14% following the civil litigation reviews, which is great news for customers, and insurers have been really quick at passing those savings straight through to customers. Aviva believes more can be done to keep premium levels down and reduce them further in the long run even. There are 500,000 whiplash claims every year, and these at the moment are compensated with cash. We pay people compensation for their injuries, but we think there's a better way, which is for the majority of those claims, which are small, minor injuries, that it would be better for consumers if they were treated with rehabilitation and care rather than compensation.
As long as I had some control over which practitioner I was going to see, I would be happy to have my physiotherapy or osteopathy treatment paid for by the insurance company.
But I've had minor injuries, and I would much rather be healthy than have a little extra cash.
I think replacing a lump sum payment with physio is a very, very good idea, because it does bypass the whole claiming things that aren't actually true and costing everyone money. And I also think it's a good thing to do. If you do have whiplash, it is quite painful and you actually get something done about it.
I think rehabilitation for whiplash is incredibly important, whether it be minor or whether it be a little bit more significant than that. Without the right intervention from a practitioner, from a physiotherapist, it can look at affecting a person's return to work, the time frames for that, their return to normal social, sporting activities and family activities, and can have a big effect on their quality of life. From all my patients, I get really positive outcomes, really positive results with them, especially minor whiplash cases. Customers always feel a lot better in short spaces of time, even with some very simple advice, exercises and rehabilitation.
So our second recommendation relates to the level at which lawyers become involved in injury claims. The vast majority of injury claims are reasonably small, they're relatively straightforward, and where there's no discussion to be had about who's at fault for the accident, they can be settled and compensated really very quickly. Aviva's data suggests that where we settle claims directly with customers who come to us without a lawyer, they receive just as much compensation as where there's a lawyer involved on their behalf. And the third recommendation is that referral fees should be banned across the scope of motor claims. In total, these costs add something like £200 million to the cost of motor claims across the insurance market. Now that's a cost that doesn't need to be there, and it's the cost that flows straight through to car insurance premiums that we believe doesn't need to be there. Now's the time to consider whether we move from providing cash to providing care. We know that rehabilitation and physiotherapy provide great solutions to injured customers, and doing those things well provide cheaper insurance for all of us.